In the first 8 months of 2020, 383,000 COVID deaths were reported across 34 countries. But in truth, the COVID death count was almost 50% higher. Why were almost 200,000 deaths excluded? Let's talk about it. We're going to cover 3 points: how different countries measure COVID deaths, and why it really matters, the missing 200,000 deaths, and how to correctly measure the impact of COVID, and finally, based on this method, which countries have been the worst hit by COVID. Disclaimer time first. I am an Australian living in Australia. With the exception of our sheep farming, rugby loving, Balrog smiting neighbours, few countries have been less impacted by COVID than Australia. We're getting less than 20 cases a day, and most of these are from people returning from overseas. In short, COVID things are pretty good here. So it'd be pretty easy to feel that this video is disconnected from the reality that more than 1 million people, mothers, fathers, sons and daughters, have died, and millions more have been personally impacted by COVID. This video isn't trying to undermine the impact of COVID, but rather equip you with the data and knowledge to better understand the true impact of COVID. With that out of the way, let's consider a hypothetical. Meet Bob, an older man living in an aged care home. Bob spent time with a person that was later diagnosed with COVID. A few weeks later, Bob started to develop COVID symptoms: fever, cough, sore throat, shortness of breath, and so on. Bob tried to get tested, but due to a peak in cases, there was no testing available. He continued to get worse, and following a full medical assessment, his doctor said it's very likely that he has COVID. A week later, in mid-April, Bob died. Surely his death would be considered a COVID death? Well, it depends. If he was in Belgium, yes, as they counted any deaths in which a doctor just suspected COVID was involved. But if it was in Germany, it wouldn't count, as they only include people who have actually been tested positive. And if Bob lived in jolly old England, it still wouldn't count, even if he had been tested positive for COVID, because up until the end of April, only deaths in a hospital were counted. And why this approach in England seems to undercount the true deaths, other aspects of it result in our overcounting. In England, up until the end of August, everyone who was diagnosed with COVID and later died was included in the count. So, if our poor friend Bob received a positive diagnosis in March, but fully recovered in April, only to be killed in a skydiving accident 3 months later, he would have been included in the COVID death count. In August this was changed, so that only deaths within 28 days of a diagnosis were included. But this approach can still miscount deaths. For instance, a patient who was diagnosed early after catching COVID could survive 29 days with a ventilator and then die, and in this situation, they would not be considered a COVID death. Up until now, we've only been considering genuine misclassifications of COVID deaths. The reality is that many non-COVID related conditions have been sidelined or even ignored during COVID. A number of countries have reported that people are not seeking out medical attention for serious issues because of concerns of an overwhelmed medical system and fear of catching COVID. The University of Sydney reported that in Victoria, there was a 30% reduction in the number of melanoma checks. Beyond delays on standard checkups and treatments and procedures, people have actually died because of lack of medical support. 3-year-old Rafa had leukemia. When his condition worsened, his parents took him to a hospital who refused to admit him because he hadn't had a COVID test. The hospital told them that the COVID tests were reserved for pregnant women. His parents took him to 3 more hospitals without success. They did eventually find a hospital that was willing to admit him, but he died before doctors could see him. Rafa didn't die as a result of catching COVID, but medical support was withheld because of COVID. This is a little bit like counting deaths in World War II. Typically, people include the soldiers who died in combat and the 6 million Jews who were killed, but they exclude the over 2 million Indians who starved as a result of colonial policies that prioritised food for the armed forces. Beyond all of these reasons for disputed figures, there are also countries that seem to be intentionally misreporting COVID deaths. As of the start of October, Turkmenistan, a country of 6 million people, has reported 0 infections and 0 deaths, though they are reporting much higher levels of death from acute respiratory illness. The autocratic government claims this is just a result of dust and air pollen. There's no COVID there. The key issue with this whole measurement problem is that it becomes very hard to truly understand the impact of COVID within a country and between countries. And this is a problem because if we can't measure the impact, we can't tell which countries are performing better and which are performing worse. Or to frame that another way, it's not easy to tell which policies and approaches are resulting in the least deaths. It becomes hard for us to learn from our collective experiences. So what is the best way to measure true COVID deaths? And where does this missing 200,000 deaths come from? How do we compare cases between countries? This is where probability comes into it. In 1744, two Scottish priests developed the idea of a life insurance fund to provide widows of priests with a pension. The idea was that each priest would contribute part of his income, which would then be invested, and if he died, his wife would receive funds to live comfortably until the end of her life. The question was, how much should each person contribute each year? They found that it was super difficult to predict when a particular priest would die, but fairly easy to predict how many priests would die each year. The same is true today. It's very hard to predict if a specific American will die this year or this week, but it's very easy to predict how many Americans in total will die this week or this year. This is where the excess deaths calculation comes in. Excess mortality is a term used in epidemiology and public health. It refers to the number of deaths from all causes during a crisis, above and beyond what we would expect to see under normal conditions. It looks at how many people have died in a period, and then compares that to how many people have died during that same period in previous years. Let's imagine that in the first week of 2021, 10,500 Americans died. And on average, in the first week of each of the previous 5 years, 10,000 Americans died. Then excess deaths would be 10,500 minus 10,000. So 500, not terribly difficult. For the sake of comparing this to other countries, we can convert it to a percentage using this formula. With the same numbers before, the excess death score is plus 5%, meaning that excess deaths that week is 5% higher than what we would expect based on previous years. Of course, this does mean that non-COVID related freak events like, let's say an invasion of nameless CGI monsters, would increase excess deaths. However, deaths that are linked to COVID, but not necessarily included in the current method, such as people in LA not seeking medical attention for life-threatening illnesses because of fear of COVID, or perhaps an increase in the suicide rate during mandated lockdown, or even Rafa dying due to the lack of medical support due to COVID, would be included. This is why excess deaths is a much better measurement of the impact of COVID, rather than just trying to measure how many people have died after being diagnosed. It captures not just the diagnosed deaths, but also all the associated deaths. Because of this, it's a much better way to understand the impact of COVID between countries, as it removes the frustration of different countries measuring COVID deaths in a different way. It is not a perfect measurement, however, because it relies on historical data, which is most often only available for wealthier countries that can afford high-quality data reporting systems. Excess deaths also doesn't provide any insight into the individual level, i.e., it gives you a really good understanding of how many people have died because of COVID in the US, but it doesn't tell you if your neighbour really died of COVID or something else. So using this measurement system, which countries have had the most excess deaths, both as an absolute figure and as a rate? As the numbers take some months to be fully finalised, let's just look from January to August 2020, where we have reliable data. According to official numbers in this period, the United States had reported 183,000 deaths. However, according to the excess death calculation, they had had 310,000 excess deaths. In the same period, the UK had reported 41,000 deaths, but it actually had 60,000 excess deaths. During the same period, Italy had reported 35,000 deaths, but it had 66,000 excess deaths. In fact, across this set of data, 2 in 3 countries had reported less COVID deaths than the excess deaths. The worst offender is South Korea, who had reported only around 300 deaths, but had excess deaths at almost 10,000. Looking at just these 34 countries in the dataset, there are 192,723 excess deaths beyond those recorded as COVID deaths, hence the missing 200,000 deaths. To think about this another way, over this period, for every 10 COVID deaths recorded, there were another 5 excess deaths that were not included. If that ratio holds true for all deaths recorded up until the time of this recording, then there have been an additional 800,000 excess deaths. It's not surprising that the US has a huge number of excess deaths. It has a really large population. When looking at excess deaths as a percentage, the US drops down from first to third, with excess deaths at 16.9%. This means that over this period, the US had almost 17% more deaths than what will be considered normal. Both Chile and Spain were worse at 19.1 and 17.1 respectively. Following the US, we see Italy at 16 and then the UK at 14.5. Belgium, Netherlands, Portugal and Sweden make up the remaining top 10. However, this list excludes Russia, Brazil, India and Mexico, whom we didn't have reliable data for. Looking at excess deaths around the world, the worst month was April, with 36% excess deaths. And the worst single month for a country was Spain, with 94% excess deaths in April, meaning almost 30,000 more people died than in April in previous years. It's important to keep in mind that COVID is not an equal opportunity killer. It kills the elderly at a much higher rate. While the 5 worst performing countries have averaged a 16% excess death rate, the excess death rate in these countries is 21.4% when looking at people above the age of 85. So on average, in these countries, more than 1 in 5 people over the age of 85 who have died are considered excess and wouldn't have occurred in a normal year. The worst example of this was the start of April in Spain, where excess deaths for 85-year-olds and above was 185%, nearly 3 times higher than what would be normally expected. To finish on a more positive note, not all countries have reported an increase in excess deaths. Perhaps this is due to social distancing or taking greater care with hygiene. 11 countries have reported a negative excess death figure. This means that the death rate in these countries is lower than what you would expect in a normal year. Latvia, for instance, reported 34 COVID deaths over this period and 18,444 total deaths. This is almost 5% lower than the 19,317 that they've experienced over previous years. And my rugby-dominated neighbours have also had a negative excess death rate and minus 1.4%. So excess deaths is the best measurement because it allows you to understand the true impact of COVID more accurately, and it allows you to compare different countries and regions with a consistent method. However, regardless of the method being used, there's no escaping the fact that the impact of COVID is huge. There are the deaths, the long-term consequences of having COVID, the psychological impact of being isolated, the loss of employment, the fear, the anxiety. The goal with making a video like this, which is hopefully educational and engaging, is not to diminish the impact of COVID, but to increase the understanding of the impact and to create discussion. So what do you think? Is it morbid to even have this conversation? Is excess deaths the best way to measure the death rate? Is there a better way of doing it? You can check out the sources below and let me know your thoughts in the comments. Be kind to each other.